Are there any risks associated with having a baby after having cancer treatment?
It's a really natural fear for people after they've had cancer treatment that they will cause some harm in the baby that they have, or that they will pass on a genetic mutation to their baby. But actually the evidence we have is that there are no increased risks of having there are no increased risks for the baby and the child that develops if either parent has had cancer.
Right.
There has been some really good research that has looked over a number of years and followed children. It's been done in women who had breast cancer and received chemotherapy.
Okay.
And those children had there were no more miscarriages within the women when they were pregnant. There were no more birth defects than when they compared it to a normal population. And actually they followed these children longer term, and there were no developmental issues.
So no health issues with immune system. If you think if you've had cancer treatment and your immune system's really hit by chemotherapy and things, obviously a developing child gets their immunity from the mother. So there's no evidence that children born after having cancer treatment have lower immunity and therefore are more susceptible to different illnesses and things like that.
There's been no evidence of that. Okay. The risk is people who become pregnant or who father a child sort of immediately after or during chemotherapy because of the effect on a developing fetus and baby, or equally before the chemotherapy has left your system while it's still impacting on the sperm.
So is there a time scale after which your chemotherapy is finished before you should start trying for a child if you wanted to?
It is much quicker in men because the process of regeneration of sperm is much quicker than in women. But in women, they will often, nobody knows, again, it's one of those evidence-free zones, so you will hear things like a year or 2 years sort of bandied around because people try and sit with something that they feel sick and they would rather err on the side of caution.
Of course,
but there have been babies conceived 3 or 4 months after chemotherapy by people because people thought they were infertile and were not using any contraception, and those babies have been okay as well. There is obviously, if you have a hereditary genetic mutation, if a woman with breast cancer, for example, who has a BRCA1 or a BRCA2 mutation, there is obviously that possibility of passing the hereditary, of your child inheriting the hereditary gene. The other thing as well to think about is that for many men, women, for women who have had cancer treatment, it may have affected other systems within their body in terms of chemotherapy that's affected their heart function or their lung function, and therefore the extra pressures of a pregnancy on their body may cause may make it a difficult pregnancy that needs to be monitored closely, and for some people they may not even be able to carry a child because of that. And I think that's about getting clear information before you become pregnant, and also that your pregnancy is monitored, that you really should be treated as what we term a high-risk pregnancy, in the same way as other people who have other health conditions are, so that things can be done to potentiate the best health for mum and the baby.
Yeah, so it's not necessarily a case that you can't, if you're fertile, you can't become pregnant because of the health risks to yourself. It's just a case of monitoring. And what about the risks of a recurrence of the cancer? Does carrying a child and the stress that puts on your body and any hormones that creates, does that have any impact on the chances of recurrence of your cancer? Obviously, I understand it's going to vary possibly between different cancers.
There's no clear evidence that it does, but I think what it is it's another anxiety for women who have had a cancer, and the thought of what would I mean, cancers can recur, and there is no reason why they couldn't recur when you were, if they're going to recur, there's no reason why they couldn't recur when you were pregnant, and then the implications that has of what do you do with the pregnancy. But even with women with breast cancer, there has been there's no evidence to show that even with a hormonally sensitive cancer, going through a pregnancy has actually impacted on their breast cancer.
And what about if you're on hormone treatments for a cancer, can you take that while you're pregnant, and you have to stop
you have to
that treatment?
You have to stop that treatment, and they quite sort of blanketly say to women who are having tamoxifen, you can't get pregnant. Nobody actually explains why. That is because there are risks to the developing baby because of tamoxifen. It's a drug that would harm the baby as it's developing. Because women, and it's going to be premenopausal women who may want to get pregnant who are on tamoxifen, and that the advice is now going that tamoxifen should be 10 years, there is now a trial that started up because women were sort of saying to their oncologist, oh, look, I want to get pregnant, can I come off my, or I'll stop my tamoxifen at 2 years, or I won't have my tamoxifen because it's important to me. What this trial is doing is actually women are having a couple of years of tamoxifen, then taking a tamoxifen break to get pregnant, and then going back onto their tamoxifen. And this is just to give us some evidence around this, because before that it was women who often felt that they were taking a risk on their cancer, but were weighing up, you know, I was 28 when I was diagnosed with breast cancer, that makes me 38 if I take tamoxifen for 10 years. That's limiting my time. So I think if we, and it's an international study, so women are being referred in from all around the world, that may give us some helpful answers around that particular question.
Okay, great. Going back to the genetic implications, is there a statistic about how, if you know you've got one of the BRCA mutations, what the chances of passing that on are? Is it a 50-50 chance, or is there a statistic on that?
So it is a 50-50 chance, because it's whether you transfer, whether the baby gets the X chromosome that has the BRCA mutation, on it. So it's 50-50. What the thing with a BRCA mutation is, though, what we don't know is whether, so a BRCA mutation will give you an increased susceptibility to getting that cancer. It doesn't say that therefore there is a 100% chance that if you're carrying a BRCA mutation you will get a breast cancer or an ovarian cancer. So what we don't know is what they sort of refer to as penetrance of therefore, so you could, in some cancers it's only a 40% chance of, if you have inherited the mutation, that you would actually develop the cancer. For women who have got a BRCA mutation or hereditary non-polyposis colon cancer, often called Lynch syndrome, or men as well, because they can equally carry, there now can be done something called pre-implantation genetic diagnosis, where you would conceive the child through IVF, but you they then can test the embryo before it's implanted to see whether that embryo has inherited the mutation, and then if it has, you wouldn't re-implant that embryo. But it's getting to quite clever science and sort of a bit. There's all sorts of ethical and moral things around that, and big questions for people to think about.
Okay, great. Thank you very much.